morning, good afternoon, good evening, ladies and gentlemen, and very many thanks for following the launch of the World Alzheimer's Report 2022. I am Paola Barbarino and I am the CEO of Alzheimer's Disease International. Today, we have just under 1,000 people registered from 99 countries, and I hope you will all participate in the lively Q&A that no doubt this report will start soon. I'm going to introduce my panelists shortly. Just a few things before. We wanted to ask you who you were, who is joining us for this webinar. So we're going to launch a poll. If you would like to respond to this poll, please. You have a few seconds to choose your area. Unfortunately, we didn't have enough space for the media as well there. I know there's plenty of media following us today. Just click other and we'll know who you are. So Jane is now going to close this poll that will give us a sense of the audience today. So a predominance of researchers, medical professional, educators, family care industry. Thank you so much. And some government representatives. I know we got a couple of delegations which are very large today. Next slide, please. Now, a few words about ADI. For those of you that don't know us, we were established in 1994. We are the umbrella organization of 105 Alzheimer's and dementia associations around the world, plus another 20. We can only have one member per nation. We represent our members at the WHO, the UN, the OECD, and other bodies. We are the promoter of World Alzheimer's Month and the publisher of the World Alzheimer's Report. And our philosophies is that prevention, care, and inclusion can be attained today. The cure hopefully will come tomorrow. Next slide, please. Now, today is World Alzheimer's Day, but throughout the whole of World Alzheimer's Month is September, we have encouraged all of you to interact with our social media accounts to spread the voice. Here are all the hashtags that you need to know. Please continue to do that as we are trying to improve on our record last year of 45 million people interacting with our social. Next slide, please. Also a short thank to our sponsors, in particular ASI and Lilly, and also welcoming Tunstall that is sponsoring us for the first time. Thank you so much. Finally, the usual word, we are a charity. Everything that we do is free for everyone to access. And if you could be so kind as to spare some money and make a donation to us, that always is very, very welcome. Thank you. Next slide, please. Now, another poll just to ascertain a little bit about the state of diagnosis in your country. So we're asking you who, in most cases in your country, signposts people who have just been diagnosed to post-diagnostic care. This is actually the subject of the report that we're publishing today. So when somebody is diagnosed, who signposts people to post-diagnostic care? A general practitioner, especially a nurse, a social worker, and so on. If you don't know, just say don't know. If you don't think there is any signposting, just say that there is none. So we're just now closing this poll. And as we can say, general practitioner and specialists are the one mostly in charge of signposting. We will have some interesting insights in the report about that topic. Now, if we could move to the next slide, please. It is my pleasure to welcome and introduce you to our panelists. But before I do that, I need to make a special thanks to some of my team members at ADI who have been an integral part of this launch. They are not today with me on the screen, but believe you me, they are behind the scene enabling this to happen. So first and foremost, Wendy Widener and Chloe Benoit, who have been editing the report, Chris Lynch, Louise Arthurton, and Taylor Patalo, who have been the pulsating engine and heart behind our World Alzheimer's Month campaign this year. Jane and Laura, Jane Sibora and Laura Aubert, who are with me on the webinar and are making sure that all of you can get it at the right time in the right place. So thank you everybody in the ADI team and the wider ADI team. Everybody really has contributed. This has been a team effort. Now, to introduce you to my panelists, today we have Serge Gauthier, a former member of the Alzheimer's Disease International Board, an incredible person who has devoted his life to the study of dementia and Alzheimer, emeritus professor of neurology and psychiatry at McGill University, Canada, McGill being the principal author of this report. Then we're going to have Emily Ong, project lead of Dementia Alliance International Environmental Design Special Interest Group in Singapore. Emily is also a board member of ADI, and she's an advocate for people living with dementia. Julien Rougerie, the program manager of Fondation Emergence, Canada, and an advocate of LGBTQ+ senior rights. Claire Webster, the co-author of the report, founder and ambassador of the Dementia Education Program at McGill University, Canada. A bundle of energy. She is the main thinker around having this report. We met with Claire now 4 years ago. It's incredible that we can have this report in front of you today, an incredible achievement. And then Maikutlo Mabille, who is the founder of the Alzheimer's Foundation Botswana. Maikutlo is an essayist in the report and an advocate for carers. And last but not least, Matt Del Vecchio, the president of Lianas Senior Transition Support Canada, the author of one of the many incredible essays in the report, which are of extraordinary interest and utility to everybody. I cannot tell you how thorough this report is on the issue of post-diagnostic support, but the authors will tell you more, and we will have another webinar next month also to delve into the topic. Next slide, please. So a few notes from me on the actual content of the report, but before then, just to remind you of some vital statistics from Alzheimer's Disease International. You've heard that many times. Every 3 seconds, someone in the world develops dementia. The total estimated annual worldwide cost is over $1.3 trillion US, and that was estimated in 2019. The figure is forecasted to rise to 2.8 by 2030. The estimated growth in number of people with dementia was 55 million having the disease in 2019 and growing to 139 million in 2050. Next slide, please. Indeed, this year has been a shock to see some of the forecast on prevalence growing so much. Just to be clear about this, already now, dementia is the leading cause of death in 3 countries in the world, Great Britain, Finland, and the Netherlands. And we suspect that it's only in those countries because the vast majority of countries still do not record dementia deaths at the highest level. And we are going to talk and think about this a little bit more at the end of this month. These are shocking figures. Just to give you an idea, even in countries like Montenegro, Brunei, and Chile, that are the other flags into this slide, dementia is in the top 5. Next slide, please. The World Alzheimer Report 2022 comes in the context of the Global Dementia Action Plan of the WHO, and more specifically addresses, as the report last year that was on diagnosis, this one addresses area 4 on post-diagnostic support and also wider topic. The most shocking report, perhaps, from the report, finding from the report, is that 85% of people living with dementia are not accessing post-diagnosis support. And we know, of course, a lot of them are not accessing diagnosis too cool from the report last year. Next slide, please. Some of the most astounding findings: 2 in 3 people living with dementia say that they do not have a personalized care plan. 54% of carers feel stress often or all the time while trying to cope with their caring responsibility. Globally, 58% of people living with dementia say they did not have access to a key worker or navigator after their diagnosis. A navigator being a person that helps you navigate the complex web that you find yourself post-diagnosis. Next slide, please. 45% of people living with dementia in low and middle income countries say that they were not offered support following their diagnosis. 2 in 3 carers from low and middle income countries say that those that they cared for are not being given access to post-diagnostic support. And 37% of people living with dementia in high income countries say they were offered nothing following their diagnosis, not even a leaflet, nothing at all. How right can that be? Next slide, please. The recommendation of the reports, I'm going to read them for speed. The national dementia plans need to become a policy priority. Person-centered care must become the norm, and it really has to, because it's such a personal thing, as you will read in the report. Care should be culturally appropriate and gender inclusive. Support for carers must be prioritized. Care needs need to be coordinated and accessible. We must continue to challenge stigma and raise awareness. It remains a severe barrier. And I'm not jesting here, it remains a severe barrier at the highest possible level in the world. A lot of people are still in denial that this is one of the major global killers. Education must be improved and expanded. Further trials of cost-effective and evidence-based psychosocial interventions are needed. There is a huge amount of evidence in the report of how important those are to just have better outcomes for people living with dementia and for their families. Finally, risk reduction must be bolstered. So many countries just are not taking this seriously enough. Next slide, please. And with that, I'm going to hand over to Professor Serge Gauthier, one of the co-authors of the World Alzheimer Report 2022. Serge, the floor is yours.
Merci. Good day to you all. It's a real pleasure to explain to you how the report has been put together and how to make it easy to read for you. Next slide, please. So my talk will be about who contributed to the report, and there's a lot of people in the audience today who are authors among the 215 invited authors. I'll say a couple of words about staging because it is one of our contribution from a research perspective, but also from a care perspective. We argue, and we have evidence to support that we have to adapt the care to the stage of disease the person is at. I will highlight the fact that some chapters among the 24 are of special interest to different groups of readers, such as clinicians, carers, persons living with dementia, educators, decision makers, and the general public. And conclusions. Next slide, please. So there's 5 senior authors at McGill, 2 editors at ADI. As I said, 215 authors who contributed to 118 essays. So that's a lot of material. There were restrictions, only 1,000 words, 10 reference, but it's really extraordinary what came out. And surveys were done, and you see the numbers of people who answered them. Next slide. So staging of dementia is important because as in medicine in general, people ask, what stage am I at and what's next? This is certainly classic for cancer. The stage you're at will determine sometimes the therapy, the treatment that's offered. And for dementia in particular, each stage requires specific care planning, as we will describe in a minute. Next slide. Next slide, please. So the symptoms associated with dementia are a lot more than just memory lapses. Decline in one cognitive domain is the classic definition. Most often in people over age 65, it is indeed memory, but it's also looking for words and directions and making decisions. The impact on daily life is important. It's progressive. And this is usually accompanied by mood changes. You are more anxious because you feel like you're losing control. There may be behaviors that emerge at different stage of the dementia that are very troublesome. And we discuss these various symptoms in the report by category: cognition, function, behavior, and mood. Now, in terms of the stages, for practical purpose, we are using at ADI's suggestion early, middle, and late stages of dementia. For the clinicians, this is equivalent to what we're used to mild, moderate, severe dementia. And we have chapters dedicated to care at the mild or early stage, care at the moderate or middle stage, and severe or late stage. Next slide, please. We have illustrations that you may find useful when talking about the disease with people. This is an illustration of the mild or early stage, where the lady can live alone, but she needs assistance to pay her bills. There's someone with her part-time. Next slide. An illustration for the moderate stage, where now there's some need for assistance to select clothes. The lady can probably live alone most of the time, but there has to be daily visits by a friend or neighbor or family member. And another illustration in severe stage, where now the person cannot live alone. There's a new problem of gait impairment, difficulty with swallowing. And in most of our cultures, these persons live in a nursing home setting or long-term care setting. Next slide. So the breakdown of the chapters among the 24, some will be of special interest to different readers. So for clinicians, 6, how to achieve comprehensive post-diagnosis support in primary care setting. We are aware that family practitioners or general practitioners, médecins de famille, are the one who do most of the work for diagnosis and management. And we are highlighting examples, especially in Ontario, the MINT program and other parts of the world where a group approach it makes it possible to have long-term care. Chapters on symptomatic drugs and disease-modifying drugs, and then special care needs for these different causes of dementia. This is a big chapter of 12 different causes of dementia, and we have essays on each of them. What's special for each kind of patient? It's not just how old he is or she is, what stage, mild, moderate, severe, early, moderate, advanced, but also what's the etiology of the dementia, and there's special care needs for each type of dementia. Next one, please. So for persons living with dementia, there's 2 chapters that are specific to them. One, the impact on their life, and one on multi-domain interventions to make their life better. Next one, chapters of interest for carers. So the impact of the diagnosis on carers, including anxiety, as was mentioned already by Paola, and interventions for their carers. Next slide. Special interests for educators and decision makers. So global initiatives and models of care are highlighted. And one of our message is education, 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 as Claire will also talk about in a minute. We think that education for all people dealing with dementia should start in graduate school and continue after graduation. We should favor online education and also involve the testimony of people who lived through the experience. Next slide. And for the general public, we have special chapters. One is the genetic impact, because usually families ask, what's my risk? My father, mother having dementia at age 65 versus 90. Cultural implications. So 13 countries or parts of the world are giving examples of how people deal with dementia in their culture. And one of our favorites is strategies towards risk reduction. There's a lot of good information out there that we can use and decrease the projected numbers that you've heard before from Paola. Next one. Conclusions from my presentation. Staging is important. We use early, middle, late. The care has to be adapted to each stage, and the people should be educated about what to expect at the next stage. There should be a personalized care plan, and it's better if you involve more than one professional. The care plan must be adjusted based on the natural evolution of the disease, so etiologic diagnosis is also important. And it's my opportunity to say how happy we have been to work with ADI on the 2 reports, last year, diagnosis, this year, prise en charge. Thank you for your attendance.
Thank you so much, Serge, for your wonderful presentation and the tour d'horizon of the report. Before handing over to Claire, I just want to remind everybody, you can post who you are and any kind of comment in the chat. and the team will reply if you have any particular queries about the report. If you have questions for our panelists, please post them in the Q&A. It's great to see so many of you online today. Now, Claire Webster, one of the co-authors of the report, the founder and ambassador of the Dementia Education Program at McGill University. Claire, the floor is yours.
Well, thank you very much. And it's such an honor to be here today to talk about the importance of education. I have been advocating and crusading for improved education at the medical school level since I had been through my own journey as a caregiver and not provided with any information in education. So that will be the focus of my points this morning. Next slide, please. Next slide, thank you. So based on the two world reports of last year and this year, one of the most important questions that we asked persons living with dementia as well as their carers is what difficulties were encountered as part of receiving the diagnosis. And it was clearly a lack of information about dementia. So next slide, please. So what I'd like to do is really key in on where the gaps in education are for the persons living with dementia and their carers, and then I will go into what the healthcare professionals are. So these are just some of the ones that stood out the most based on all of the essays and the amazing personal testimonials that we have received from people around the world. So clearly there's a lack of education on the early signs and symptoms of dementia, the importance of seeking a diagnosis to ensure best quality of life and care. A lot of people say, well, why bother receiving a diagnosis if there is no cure? But it's so important to receive that diagnosis in order to begin planning for the future with regards to financial, legal, and advanced care planning wishes. And most importantly, it's so that you could live the best quality of life possible. There's a lot of confusion about the pathway to receiving a diagnosis in terms of who do I go see? Do I go see a family doctor? Do I see a psychologist? There's a lot of confusion around the pathway, definitely around managing challenging or responsive behaviors. People don't realize all the safety concerns that happen as the disease progresses. And we have some amazing chapters about how to live the best quality of life possible, what leisure activities and cognition stimulation therapies to enhance well-being, lack of knowledge about how to access support from community organizations. What does the public healthcare system offer? What does the private healthcare system offer? How do we transition to long-term care? The whole navigation process, there's a big gap in that. And most importantly, the carer's own ability to recognize their own limits and ability to cope with overwhelming feelings of guilt, anger, and grief, right? We often feel that we're alone in our struggles. Next slide, please. So the gaps in education for clinicians and healthcare professionals, as we saw from last year's report, not everyone is properly trained with regards to how to do proper assessments and diagnosis. A lot of healthcare professionals have not been trained in terms of the signs and symptoms and the evolution of the illness. We see that in different courses, nurses, social workers, doctors may only receive 1 to 2 hours of training on post-diagnostic support. So there's a lack of education with regards to communication skills in terms of relaying the diagnosis to patients, talking in language that people could understand, not using medical terminology with people. The empathy and compassion in relaying a diagnosis is not necessarily taught. Non-pharmacological approaches for managing challenging behaviors. Assessing the ability and knowledge of the carers. A very interesting essay was written about when occupational therapists are doing home care assessments to assess the person, there's not necessarily anyone assessing the ability of the carer to take the best care possible of the person. And also, what's not being taught is knowledge about support services to refer the persons living with dementia and carers to their local community organizations, even how to navigate the public healthcare systems. So that's where the major gaps are. Next slide, please. So when we talk about the call to action that Paola talks about at the beginning and the recommendations to everyone, yes, governments, public and private healthcare agencies, and Alzheimer's associations all have an important role to play. But the biggest impact will happen when medical students and allied healthcare professionals of the future are provided with a comprehensive education in post-diagnostic management of how to manage this disease. They deserve to have the training. So next slide, please. So I'm calling for a call to action to academic institutions around the world to consider developing, enhancing, and improving your curriculum of dementia care education for all students, all like your nurses, your social workers, the medical students, for occupational and physical therapists, for everyone. Enhance your curriculum. Invite persons living with dementia and their carers into the classroom to share their journey with the students. It's very important in order to be able to offer a patient-centered approach. And lastly, think outside the box. Offer community outreach programs within your universities, within your colleges, your training centers that could help the community, and that will also provide important internship opportunities for the medical students. You can refer also to chapters 22 and 24 for some innovative ideas that are coming out from around the world. And I'd like to thank you for this opportunity.
Thank you very much, Claire, for this great presentation. It kind of belies so much information that is in the report. And I think something that you said about the importance of compassion, of empathy, when delivering a diagnosis and the post-diagnostic support that should come is not coming, is one of the reasons why this report was written. And we hope it's going to be the definitive work on this issue. There is some amazing stuff coming in the chat. There is something I've just read from someone in the UK saying it's not her mother's fault if she's got dementia rather than cancer, and her personal fight to get any help post-diagnosing and having to fund it. Please continue to write these. There's a lot of people sharing their reports and the things they're publishing today, World Alzheimer's Day. This is wonderful. It's just bringing us as a community, or just tell us who you are, which is a great thing to read. But also, please remember to write some question for our Q&A at the end of this panel. And with that, I'm handing you over to Emily Ong, board member of ADI and essayist for the report, and the project lead of Dementia Alliance International Environmental Design Special Interest Group. That's a bit of a mouthful, in Singapore. Emily, the floor is yours.
Thank you, Paola. Yeah, so as you can hear from Paola, that 85% of the people living with dementia and the care partner have no access to post-diagnostic support. And 37%, what is more scary is that those from the high-income countries also have no support, for after the diagnosis. And I'm happen to live in a very high income country called Singapore in Southeast Asia. Yeah, so when we were newly diagnosed, the one most important thing is that I experienced a lot of anxiety. The anxiety would have been minimized if there is information made available to us. But relevant and appropriate information is not just a general information. And peer support to know about other people who are living with dementia, and also for care partners to ways of how do I maintain and support my independence for as long as possible. And when I was diagnosed in 2017, there was no post-diagnostic support in Singapore. And it was only in 2020, Singapore finally have a post-diagnostic support. And to this day, there is two agencies that provide. One is Dementia Singapore, and the other one is Agency for Integrated Care, which in short we call AIC. But both of these is under separate service model. And so their criteria for eligibility is also very different. So depends on which hospital that you are diagnosed, then you will be referred to either Dementia Singapore, post-diagnostic support, or AIC. So for person living with dementia and the care partner, the difference in all these post-diagnostic support make it very confusing for people. One is for 6 months and one is for a year. But to be very frank, even that for me as a person living with dementia, navigating my journey, I felt that even a 6 month or a year is just too short, And we need a more sustainable post-diagnostic support ecosystem that really helps to have the potential to improve the delivery of the personalized and integrated experience while enhancing the providers' productivity, program accessibility, and affordability. We need post-diagnostic support from the minute we are diagnosed to the end of our journey. Even if you manage to come up with a customized, individualized plans within the 12 months while you help the person to moving forward, it might not necessarily be relevant and appropriate anymore. So even though our overall decline is gradual, but the changes in our cognitive abilities can be unexpected. Take, for example, myself. 12 months ago, electric kettle works well and helped me to resolve an associated issue I have with whistling kettle. Few months back, I started to miss the last step of switching on the on button. And in this situation, the earlier plan of helping me to cope with the association issue is no longer relevant. So hence, the post-diagnostic eco-service system should be an ongoing, unlike now, which is very narrowly defined within the organization and is very silo functioning. It should take an integrated service care system that involves multiple stakeholders and that includes palliative care, peer support, and social care services for us. Thank you.
Thank you very much, Mabille. I mean, there's been a huge amount of feedback on the chat line as you were speaking about how delighted people are to see you here and representing in particular people living with dementia. But your work in this last year has been so wonderful and so specific. I do really encourage people to follow your social media for all the incredible things that you're doing in Singapore that are really changing the life of people day by day. That title about environmental design belies a huge amount of activities. I mean, Emily's been trying to change the entire underground system in Singapore and public transport. It's just a force of nature. So thank you very much for being with us today, especially on post-diagnostic support and your testimony, of which the essay is incredibly powerful in the report. I now do give the floor to Maikutlo Mabille, one of the authors of another very moving essay in the report that I mentioned in my introduction to the report. Maikutlo, I hope the audio is working for you. The floor is yours. I have a feeling the audio may not be working for Maikutlo. So, maybe she is with us. Maikutlo, can you hear me?
Hear you? I can hear you.
Excellent.
I forgot to unmute myself. Pardon me. Okay, thank you, Paula, for the warm welcome. Today, I decided I'm not going to use any slides. I'm going to speak from the heart, but I made a few points of where I would like to jot down. First of all, contributing to the World Alzheimer's Report 2022 as an essayist has been a privilege, because in my quest to give proper content, I was able to dig in deep and actually revisit my journey with Alzheimer's from inception. So now I would just like to tell everyone that prior to me giving care to my mom, prior to my mom's diagnosis, I had no history of knowledge on Alzheimer's or dementia. The first day I heard about it was when my mother got diagnosed, and that was actually quite shocking considering our family history with Alzheimer's in our family, being that my grandmother lost her life to Alzheimer's. So this has been very hard. My mom is actually the reason why I founded the foundation. And she inspired the whole idea about giving support and offering support to people living with Alzheimer's and caregivers, because I understood that out there are also people like me who are actually less privileged than I am in all aspects. So without taking further, I will only try to bring light to issues that we face here in Botswana in regards to Alzheimer's and dementia care. There's no policy in place in regards to Alzheimer's. So there's an initial meeting that has happened with the Ministry of Health between the organization, our organization, and the ADI and the ministry. There was an initial meeting that we are yet to follow up. The first encounter was really not promising because we were met with a lot of resistance. I have since come to appreciate the fact that people resist what they do not know. The fact that there's zero education and awareness around dementia in Botswana and Alzheimer's is the major contributing factor to it being looked at sideways. Is because there isn't any awareness, and because of this fact, there's also the issue of taboo and stigma around the topic, like we do not speak about. However, these factors do not disqualify the fact that the problem is there of Alzheimer's and dementia. And there has to be a lot of work that needs to be done in terms of letting people know, raising awareness and educating the public. The spreading of the information could not go as further as we would hope that it would, due to like our lack of support financially and otherwise, because corporations are not willing to spend money where they do not understand. So we are met with that resistance and that wall where we have to like break through and let people know what this is about before we can get to a space where everybody's on board in terms of giving support where it's due, and making sure that the government now starts paying attention and making sure that our clinics and hospitals actually accommodate people living with Alzheimer's and dementia and their caregivers. Like, we never received any support after my mother's diagnosis. You know, after that, it was pretty much we're on our own. All the research that I had to do by myself in order to like help my mom, like her diet and everything, and the progression of the disease is something that I had to find out by myself. There isn't support. They'll tell you that there's nothing that they can do for the person living with dementia, but there's something that they can do for you by offering you counseling as support. Unfortunately, the type of counseling that they offer is just general. The person who will be speaking to you, trying to offer support to you, has no idea what you're talking about and cannot relate at all to the topic of Alzheimer's and dementia and the repercussions of having to have like a family member who's living with the disease. So that's a challenge on its own. Another thing is lack of data. There's no data whatsoever around the topic of dementia and Alzheimer's in Botswana. Zero, nothing. There's nothing at all that we have to work with. So the organization is faced with now trying to put all tools in place to try and accumulate as many people as we can to register with our organization, such that we can have an idea of the mammoth of the task that we have ahead in terms of numbers. That is one challenging aspect. We can never give a correct enumeration to the type of issue that we have and how big it is. Another issue is I have an issue with the way that neurodegenerative cognitive disorders are packaged with mental illnesses, because I feel like it robs the spotlights that it needs. You know, it minimizes what it is. So that in itself is an issue, because they'll always say that there's a mental issue. Whereas when you get to look at Alzheimer's or you look at dementia, it's completely different from a person who suffers from schizophrenia. I believe that the two should be distinguished, and the difference must be educated. People must know what they are working with. So all in all, these points that I just laid out are the major points, the umbrella points that are giving issues besides everything else. So my time is up. That is all.
Thank you very much, Maikutlo. I know that you could continue to speak about that and also the challenges in particular you have in Botswana. But thank you for your contribution to this discussion and to the report. Again, a very moving contribution that you give there. Can I now give the floor, please, to Julien Rougerie? Julien, the time is yours. I just wanted to remind briefly everybody, if you have a question, I've seen a lot of questions asked in the chat, please ask them in the Q&A so I can pick them up in the Q&A bit. Julien, sorry, the floor is yours.
Thank you very much, Paola, and good day to everyone. It was very interesting to hear Maikutlo testimony, because he made us realize that depending on where you are in this world, it's really going to shape your experience as someone dealing with dementia. And as for my part on the World Alzheimer Report, I wanted to stress the importance of who you are and how this can shape your experience as someone dealing with dementia, who you are, and that means your life course. And for example, I think it's important to understand that for most people who are part of sexual and gender minorities, or LGBTQ+, that means people who are homosexual, bisexual, or trans, it's really important to understand that they have experienced many forms of rejection, exclusion, or discrimination throughout their lives. And this is especially true for a majority of LGBTQ+ older adults who did spend most of their lives in societies where sexual and gender diversity was considered a crime, a mental disease, or a sin. This is very true in Western countries, but it's important to keep in mind that in many countries throughout the world, or in some communities, it is still considered a crime, a mental disease, or a sin. Even here in Canada, yet one of the most progressive countries in terms of recognition for LGBTQ+ communities, most older LGBTQ+ adults keep hiding their sexual orientation or gender identity because they don't feel safe to be who they are, especially when they navigate health and social services. Another example is senior homes. Most LGBTQ+ residents tend to go back in the closet or stay in the closet. And yet we're talking about a 10% of the world population, no matter where you are in the world or no matter what community you are part of. And it's important to realize that hiding who you are, hiding such an important part of you is really going to take a lot of energy and a lot of abilities which you know are going to be affected by your condition at some point. So it can be really stressful to deal with dementia when you are part of the LGBTQ+ communities. The situation of not being able to being who they are is going to weaken their mental health, and also is going to affect their ability to access health and social services. Indeed, when LGBTQ+ people are reluctant to use health and social services, it constitutes an additional burden on themselves and on their caregiver. Indeed, caregivers may have to compensate the lack of inclusivity in providing more services themselves. Here, it's important to keep in mind that LGBTQ+ seniors tend to be more isolated than the average because many have faced rejection from their families and have less children. Also, they could not be fully involved in a same-sex relationship because of social condemnation and by lack of general status around such unions. As a result, their social network revolves more often around their friends or chosen family, if you prefer, and because their caregivers tend not to be family related, and because most representation of unpaid caregivers continue to emphasize on traditional family norms, they may not be fully recognized as caregivers by support organizations. So I invite you to learn more about LGBTQ+ seniors and their carers by reading the article and contacting me for further detail. Thank you very much.
Thank you very much, Julien. That is an extraordinary perspective. As you all know, we try in our report as much as possible to really represent what it means to have and experience these kind of issues everywhere you are, regardless of gender or nationality or language. We all have similar problems, but each subset of the population has different issues to address. So I hope this has opened your mind a little bit about some really important issue, and we haven't even touched on the issue of those Juliana has mentioned in passing that live in countries where they cannot be themselves, and then they develop a disease that makes it so difficult for them to live their later years in a good way. So thank you very much for this little insight. There is a lot more into the essay. Now, it is my pleasure to introduce you to Matt Del Vecchio. Now, we could have chosen many of the essays in the report, but we chose Matt because he's particularly focusing on something that a lot of people wonder about and wonder what to do. Matt gives a really important advice around long-term care and how to choose it. It has to be said, we are publishing other reports next month that focus on countries where long-term care in care homes is not culturally the chosen path and the chosen experience. But in a lot of high-income countries, it is. And Matt in particularly focused on the issue also of carer guilt, which I found extremely well put when I was reading his essay. So Matt, the floor is yours. Tell us your view about these important issues. And please continue to post your question. Thanks you for your question. There's a lot of them in the Q&A. Please continue to do it. Matt, the floor is yours.
Well, thank you very much. And many thanks to ADI for having me as a speaker to discuss planning for transition of care. And I'm going to speak to you today, not from a medical or clinical perspective. Instead, it's going to be from our team's perspective, working closely with families on a daily basis. Families that are in the fire. Now, perhaps it might be some billowing smoke and the situation is manageable, all the way to the extreme where it may be a blazing inferno and the family simply armed with a garden hose to try to put it out. And hopefully in these next 5 to 6 minutes, there'll be a ray of hope for families in dealing with the transition of care. Jane, I don't know if you could take over from here and just slide me over.
Yeah.
There we go. Thank you. All right. So I'm going to talk to you a little bit about aging in place. What are some of the warning signs that it may be too much at home, and selecting the ideal senior living communities? What do we need to look for? And of course, the important topic of dealing with guilt. Next slide. You know, this is a term we're seeing more and more these days, aging in place. And let's face it, most of us want to stay at home as long as we possibly can. It's our comfort zone. And through the dementia journey, there is this evolving adaptation of care, both for the loved one, sometimes referred to as the person living with dementia, you'll see in the reports PLWD, as well as the carer. And over time, there will inevitably be the challenges of adapting to increased physical needs as well as cognitive needs. I also want to address the pandemic effect. The world has seen the devastation in long-term care homes. And as a result, people are afraid, they're anxious. And so what happens? You stay at home as long as you possibly can. In some cases, even to their detriment. Next slide. So what are the warning signs that it may be time to consider a transition? Is the environment safe and secure at home? Is the person living with dementia living alone or surrounded with care and support? Are things like stairs becoming difficult to navigate? Is there a flight risk? Is proper care being provided, both from a physical and a cognitive perspective? Let's face it, most carers have been thrown into that caregiving role, and many have not been formally trained to provide proper care. They are simply doing the best they can under the circumstances. And so, for example, is it becoming more difficult to deal with things like transfers and bathing, incontinence? How about dealing with aggression, paranoia, and the continuous repetitive questions? Carer stress is a huge factor, and every carer is able to handle stress a little differently. And the odds are that stress will only increase over time. Has it reached a point where it is no longer sustainable? Are there bad habits that have been developed, such as excessive use of alcohol and drugs, simply trying to cope with the situation? Are you holding that garden hose, just trying to put out that blazing inferno? And finally, is there financial stress? Government support is very challenging. Many families are forced to hire privately. Some carers even have to quit their jobs, resulting in loss of income and missed career advancement opportunities. Next slide. And it may, we need to go back one. Oh, we're missing senior living communities in there. What I'm going to talk about just before we get into the guilt is about selecting the ideal senior living community. It may reach a point in time where families need to choose a senior living community. Now, what to look out for? Most important factor is the level of care being provided. We sometimes mistakenly think that a long-term care residence or a nursing home type atmosphere is required for someone with dementia. Not true. Many people with dementia are still quite healthy from a physical perspective. And in these cases, you don't need a long-term care home. You need a community that specializes in memory care, staff that has been properly trained. They understand how to deal with situations, perhaps with resistance to bathing and showering, and being able to distract and redirect, knowing how to deal with aggression and anxiety. And there are many more factors, such as staff to resident ratios. Very simple, more staff, higher care. You want to match the right culture and environment. And there are many more listed in the World Alzheimer's Report in Chapter 8 about what to look for in a senior living community. Next slide. Dealing with guilt is never an easy decision to transition a loved one. It's extremely emotional. And the key is being able to move from an emotional mindset to a rational mindset. It's much easier said than done, that many of you already know this. Try to accept the progression of the disease and understand it is not your fault. And reflect on those warning signs we just discussed. And truly look in the mirror and be honest with yourself when answering the questions. Is it safe and secure? Is the proper care being provided? Are you overly stressed? And is there financial stress? If you could honestly answer these questions, then this will assist you in moving from that emotional state to a rational state. And finally, understand that there will be an adaptation period in a transition, both for the person living with dementia as well as the carer. It's not easy, but don't be surprised that after this adjustment period, it may not be as bad as you thought it was going to be. And if I could end this presentation with a word of hope, if there was a silver lining with the pandemic, it's shown a spotlight on long-term care homes and the treatment or mistreatment of our elderly. Progress is being made, and we all collectively need to continue advocating for improved memory care communities. Thank you.
Thank you very much, Matt. As I said in my introduction, an essay packed with really practical advice and a lot of insights from your experience. I would like to thank all of my panelists, but the job is not finished here because we've received a lot of questions, and now I'm going to open up the questions to everybody. We have time, and I encourage anyone that may have more reflections and more questions to please post them in the Q&A. I would like to start with the first question from Jessica Rock, and I would like to address this question to Emily and to Julien and to Maikutlo. So if all of you could give me a couple of minutes reply on this, please. The question is, what do you think helps people in your communities who are living with dementia and their family members feel comfortable sharing their experience publicly? Now, this is a question of great importance also to ADI. A lot of our members are finding it very difficult to find any advocate in their countries. There is nothing like a person that speaks your same language and of your same culture to stand up and talk about their experience. But so often we find the stigma prevents people from sharing their experience. This is why the testimony of Emily, of Maikutlo, of Julien are so important. So Emily, would you like to start, and Maikutlo next, and then Julien? Thank you.
Okay, yeah. For us in Singapore, it is very unique because Dementia Singapore have a program called Voices for Hope. So it is, I would say that it could be the first, the only one in the world, whereby we really reach out to people who are diagnosed with dementia and their care partner, and then those, and also people who wants to become an advocate. So they go through this program, and where I'm one of the co-facilitator. So in a way that, you know, you cannot expect a person living with dementia and their care partner to step up when they themselves have not gone through and experienced and processed the raw feeling that they are now having to deal and live with dementia. So during this program is about 8 to 10 week course, and we help the people to go through, you know, to talk about their feeling, and then to understand why their voice is very important, and that is and then to understand the need and the discrimination and the stigma, and what is the impact of their voice. So in this way, Dementia Singapore, we are very successful in having new advocates stepping up. And so I hope that, you know, countries would also reach out to us in Singapore, and you might want to consider something, a program like that, really help people to build them up to become an advocates, and to hear from fellow advocates, whether it's a person living with dementia or care partners. Yeah, thanks.
Thank you. Maikutlo?
All right, thank you. Because we're relatively infants in this whole fraternity, we're learning as we go, but I'm pleased to share that in the last month, on the 18th of August 2022, we had a first of its kind workshop. It was a volunteer and home-based care unit sensitization, where we were bringing everybody up to date with what dementia is, what it's all about, the type of work that we do, and what contribution we would like them to bring on. And also encourage that whatever they took from the exchange, they'll go on forward to also share with people that they'll meet. And we are hoping that there'll be more of those, because the more people we have on board, the more options they'll get to choose from, whether they want to do the advocacy and to be the carer part. So in that regard, so far, that is what we've done, where it's like in person, and it's interactive with people that have shown interest in our course so far. But we would definitely like to see us at a level where Emily Ong has just said that Singapore has such things in place. We look forward, we hope that, you know, in maybe 2 or 3 years, we'll be in a position where we'll say, no, we have these type of programs, and this is what we've been able to achieve, where people are actually literally fighting to come on board, because now will be the hottest thing that is happening in town.
Thank you very much, Maikutlo. And Julien?
I also believe that education is the answer. That's valid for many communities, but including LGBTQ+ communities, of course. I think services need to be more proactive in demonstrating the fact that they want to be inclusive, and that's possible through education and through the tools that we offer at Fondation Emergence, for example. And also, it's important to treat chosen family as you would treat the family of origin. That's another great practice to make people feel comfortable being who they are in your services.
Thank you so much, all of you. I want to move on and ask for shorter answers, because there's a lot of questions. The next one is for Claire. Claire, we picked this up from the chat line. Very interesting question for you. From your point of view, what are the current barriers to bringing a comprehensive dementia education curriculum to medical schools? Is there an openness and willingness on behalf of university to pursue providing proper and thorough training on dementia?
So, well, first of all, McGill University, we would be very happy to share our program with the world. So anybody that would like to know how we established our program, please contact me. So what the barriers are, at first and foremost, I mean, you have to have somebody that's really going to lead it. So having been a person with lived experience and having had no support from the healthcare system whatsoever, I felt so incredibly frustrated. So when I approached McGill University, I had no affiliation with the school. So you don't have to necessarily have an affiliation. The first thing that's going to happen is they're going to tell you, well, our curriculum is already full, because there are other diseases that need to have, they have to fit it into an already full curriculum, right? But you really, and I'd like Dr. Gauthier to answer with me, give his point of view, but you really have to have a champion that's going to be willing to lead this, because a lot of people approach universities with ideas, but unless you really are going to commit to it, you have to have the support from, I'm so incredibly fortunate to have the support of Dr. Gauthier and Dr. José Moret to lead this program. You really have to be committed to it. It also requires funding to be able to do this, but and I think first and foremost, you have to have the belief of the Dean of the Faculty of Medicine, who in our case, David Eidelman, really believed in me. Dr. Gauthier, would you like to add a few things?
I think you said it very well. You need a champion, someone with a passion, and to be a bit patient, because curriculum changes take time. And if you take time away from diabetes or cancer, maybe they're also the students missing out on something important. But dementia being so important now and increasing in importance, mortality was referred to by Paola earlier. Yes, we think dementia should have an equal weight to cancer and heart disease in the curriculum.
Yeah, and we developed a dementia companion guide, which if you all go to mcgill.ca/dementia, it is for everyone across the world to use, to make links to. It's been translated into multiple languages. So if you don't have a curriculum in your university or training center, just even begin with this book. Please use the book, share it with the medical students, share it with your communities, share it with your carers, your persons living with dementia. That is why we made this book, and we are continuing to translate it into as many languages as possible.
Thank you very much, Claire and Serge. I mean, the point raised by Claire is so important. We have launched our own accreditation of ADI for training programs around the world last year. And we have been actually really positively struck by how many universities, training centers have applied for accreditation. It's been wonderful to see. It means that it's still a subject alive and kicking. However, we do know that more and more people are developing dementia, and there is a massive need for healthcare training in this area, and there's just not enough professional carers even being trained. We know that in some region of the world, this is a massive issue. So there is a giant need, and it's a really important area. Everybody can take inspiration from the work of Claire and Serge in the report. But Serge, I've got a question which is just exquisitely for you. It's a question from Peter Ong, and he says, what is the optimal duration of post-diagnostic support considering resource constraint? Or is it tiering according to patient and caregiver needs better? It's a really interesting and complicated question, Serge. Over to you.
Well, the short answer is there should be care until you die. And there will be a change of who is more closely involved with your care as the disease unfolds. So if you're a 65-year-old diagnosed with Alzheimer's disease, you will probably see a neurologist because it's a relatively early age of onset, but then the neurologist eventually his role or her role will be taken over by family practitioner and then move to a memory care environment and then long-term care. So there's different, there's a continuum of care that we need to work out better among professionals. So the short answer is the care after diagnosis should be until you die, and then beyond, because the family also needs support and maybe genetic testing like the 65-year-old I just mentioned.
Thank you very much. And there is obviously more that you can read in the report. Sergio, I've got another question that is for you. This is not really straight into the report, but I know you have the answer for that. It's a question from Jenny Ingraham that is saying, to describe any international effort to develop an Alzheimer registry, I would appreciate how the countries who have an Alzheimer registry have managed to achieve this. Now, this is way beyond the report, but it's something that you work passionately towards. You may want to explain to our audience what the registry is before answering the question. Thank you.
So I think the intent of the question is, can we know the numbers of people with dementia and what stage they're at and where they live and what kind of services they need so we can plan better? So yeah, it's required everywhere. It's not available in most places. There's an ethical issue of disclosing the diagnosis, even if you don't have the name of the person. There's still some perhaps a Medicare type of identifier when you have a registry that is for your province or state or country. So it has to be voluntary. But then if it's voluntary, you may not know about many people diagnosed with dementia. So it's a bit of a social debate. I think we should do as well as we do with cancer. There's a registry for cancer and the cancer type and what treatments work best and where people live and so on. Why don't we do that for dementia? So the important question raised, maybe it's a topic for a special report by ADI or a publication. We have to think collectively, why don't we have registries about dementia, especially the dementia type, as we get more into biologic diagnosis, more accurate diagnosis and new treatments. So we need to have numbers to say to our opinion leaders and deciders, look, this treatment works for this population in particular, and it's demonstrated by this kind of registry. So thank you for the question, and yes, we can do better.
Thank you. Yes, it is something that we probably should get into because there's a lot of talk about it, but not much has happened yet. And many countries have tried, but the efforts become isolated rather than coordinated. There are a few organizations that also have been trying, but not perhaps on registries sufficiently. We've written about that a lot into Plan to Action, which is our other great report that comes out in May. You can read about that there. And somebody will put the link into the chat line. Given that we have been called into the field here, there is a question here from an anonymous attendee that we can answer from ADI. When we talk about treatment, do people living with dementia have equal access to anti-dementia drugs? Is ADI helping to get anti-dementia drugs on the WHO essential medicine list? Once again, a broader question which doesn't really belong to this report, but on which we are working. Together with Louise Robinson's group at the University of Newcastle, we are indeed applying to put the essential dementia medication on the WHO registry. You can read about that more on our website, but more critically, given there's so many of you online, you can answer a questionnaire that we have out in which we're asking people to tell us about their experience. That would be extremely helpful. A link to the questionnaire will be put by the team on the chat line shortly. So thank you for asking that. Now, there is a question from Carmel Gean, who is herself an advocate for carers, around younger onset dementia. More and more are being diagnosed under 65. What's the advice? They need to be empowered to make their own choices, staying working and active in their communities. Claire, there is an essay about this in the report. Can you tell us a bit more about that?
About staying active. I'm sorry, I'm trying to remember all the different essays that we had read, but with regards to, I think what was really important is one of the essays is because of people who have early onset, they're still working. And there's a really great essay in the report about a call of action actually to the workplace to become much more sensitive to people who are being diagnosed with dementia, to try to encourage them to stay and be able to work, for a longer period of time, to be supportive of them. And for sure, with people that are getting early onset, it's a different reality, especially for the carers. What we see is the caregivers to people, the carers, the care partners for people who have early onset are oftentimes university students or younger children. So there's a very different impact on the journey of somebody who has early onset. And maybe one of the my fellow colleagues could also jump in on this.
Serge, would you like to go
Yes,
ahead?
thank you, Claire. You summarized it very well. I'll just add that There's special clinics now in most countries for young onset dementia before age 65 because the differential diagnosis is different than over age 80. And there's maybe a genetic component for the children or brothers, sisters. And finally, the care has to be adapted. As you said, Claire, many of them are still working. So there's a transition out of work that should be progressive, not all of a sudden. And the needs of the family are different because of the wife or spouse still working and the children still in school and so on. So that's part of what we are saying as a general conclusion. The care has to be adapted to the particular circumstances of the person with dementia.
Thank you very much, Serge. Questions are coming thick and fast. Can I ask everybody to keep their answers quite short? Thank you so much. There's a beautiful question in the chat line. I realize that bereavement care for caregivers is also an important part of the spectrum of care. What is your view? I often have to prepare caregivers for life after the person with dementia passes away. Claire, perhaps you, perhaps Matt, would you want to come in on this one?
Yeah, I mean, my mom passed away in 2016, and I would have never been prepared for the, I would call it the post-traumatic, the post-traumatic feelings that I had, because unfortunately, nobody prepares you for the grief that you're about to experience. And nobody prepares you also as you have to witness the end of life of what somebody is going through, which can be quite traumatic. And so it is something that, with regards to also, we talk about education, just preparing people about what they may or may not feel after this journey ends, because unlike other illnesses, the whole concept of anticipatory grieving begins in the moment of diagnosis. And it doesn't just end after a person passes away, especially for the carer. I'll give somebody else an opportunity to jump in as well.
Thank you very much, Claire. I've got here an incredible question, though, about stigma of diagnosis. I'd like Emily and perhaps Julien to comment on this. Is essentially this diagnosis essentially writes people off who have dementia rather than seeing the person living with dementia as a continuing contributor to our world. And the person writing it, Kate White, is part of the movement for social justice for dementia called Reimagining Dementia, a campaign for social justice. So Emily, please, and Julien, perhaps you want to comment on this.
Well, I cannot get hold of the question. Can you read it?
Sorry, I will get it again. The ongoing stigma of a diagnosis, which essentially writes people off who have dementia. So the moment people have dementia, as we know, often the doctor don't even speak to them, they speak to the family. Rather than seeing the person that lives with dementia, like yourself, as a continuing contributor to our world. And the person speaking is part of a movement for social justice, just to give you a context.
Okay. Yeah, it is actually, it's happening everywhere, even in my place here in Singapore, in Malaysia, that is why I guess there is still a lot of things that the person living with dementia and also together with the care partners for those who are no longer able to say a lot as a person lost their language, and to continue to step up and make their voice heard. There is no one straight answer, and it is very difficult because unless you can change the whole system of the healthcare and then send everybody brain to have a scan and fill in with the new way of looking at people living with dementia are still very capable and with full still have the capacity and the capability, the stigma is going to continue on. But it doesn't mean that we stop doing it. We have to continue with the fight. Yeah.
Thank you, Emily. Indeed, we won't stop. Julien, do you want to come quickly? We've got 30 seconds.
Well, as Emily said, there's no easy answer to that question, but yeah, Alzheimer and dementia are very, very personal disease. So it's really important to add a strong human component when you announce a diagnosis, and then when you care for the person. And there's many, many ways to do that.
Thank you very much, Julien. As somebody saying in the chat, Thank you for sharing your point of view from all over the world. We need to know that this is global. Well, whenever you come to an Alzheimer's disease international workshop or webinar, you do know that it's global. We are all in this together, and we are all working together to know better about dementia, to know better about Alzheimer's, and to do our best to eliminate for once and forever the negative attitudes that still keep cropping up, as I said, at all levels of society, unfortunately. My last slide reminds you that it's still World Alzheimer's Month. We need you to continue to use the tags for World Alzheimer's Month, World Alzheimer's Day, no dementia, no Alzheimer's. Please use them. We need the weight of your collective effort because this is going to be useful to us as we bring forward some of our large campaign, like What's Your Plan, is asking governments around the world, what are they doing to prepare for dementia? Dementia is not going to go away, it's growing all the time. There's no point denying about it. It's just there and they need to do something. So please continue to do this wonderful work you've been doing collectively. I thank Serge Gauthier, Claire Webster, Emily Ong, Martin Vecchio, Julien Rougerie, Maikutlo Mabille for their contribution to this wonderful webinar. And I thank you all for being with us until the end. We will try and answer questions that were unanswered individually. Thank you very much. A recording will be available soon. And see you at the next World Alzheimer's Month webinar very, very soon. And goodbye.